So thank you all for coming back to the AVH webinars, monthly study group webinars. Tonight, it's my pleasure to introduce my friend, vet school classmate, and just a great person, great homeopath, Shelley Epstein, or Epstein, who will talk to us about the basics of the action of primary and secondary action of homeopathic medicines.
Good evening, everybody. Thanks for coming. I know it's Valentine's Day and a lot of you would rather be doing other things, but it's also Ash Wednesday, I learned. So tonight I want to talk about primary and secondary actions of our homeopathic medicines. And I think this is sort of one of the most important parts of homeopathy for me. When Dr. Pitcairn taught us this years ago, it clarified a lot of homeopathy for me. And then as the years have gone on and I've looked at a lot of the science behind it, it's made even more sense. But this is in essence what we do, is we give a medicine hoping to elicit a response from that medicine. So we're creating a stressor to the body and then getting the body's rebound in the form of cure. So let's see, I got to get rid of, whoops, sorry. Okay, now I can see it. Whoop, wrong one. Did I just lose the screen there, Jeff? Get rid of this one here. Hold on. Yeah. Okay, I'm going to get it open. Hold on.
Comment. We'll go back and forth.
Open recent. Yeah.
Yeah, I'm just looking. Why does it have behavioral still there? Okay. All right, so bear with me while I search for it.
Because I thought I saw it. So.
Yeah. All right. Okay. Maybe I'll just leave it like that. There we go. So tonight, what my goals for everybody, one of the hardest things I think is distinguishing between the primary or the initial action of the remedy and then the secondary, or what we call the counter action or reaction of the remedy that we're giving. And we'll get into that in a little bit. The other thing is it can also often be a challenge, especially in treating things like skin cases, where we need to interpret what we're seeing. You know, is the animal itchy because it's just itchy? Or is it itchy because we stopped the pred and now we gave a remedy, and are we seeing a remedy aggravation? So there can be a lot of confusion there. And then I also, at the end, this part hopefully will have some new material for people, want to go over how these actions and the counteractions are seen in the provings, and then consequently in our repertories. And I think this will be pretty valuable for everybody. So most of the information of on this in the organism is found in aphorisms 62 to 99. And we'll start with aphorism 63. Where Hahnemann says, each life-impinging potence, each medicine, alters the tuning of the life force more or less and arouses a certain alteration of a person's condition for a longer or shorter time. This is termed the initial action. So we give a remedy and we get a change. While the initial action is a product of both the medicinal energy and the life force, it belongs more to the impinging potence of our medicine. Our life force strives to oppose this impinging action with its own energy. This back action belongs to the substantive power of life and is an automatic function of it, called the after action or counteraction. So this is important. The initial action is mostly from the remedy. That's what you would see in provings, for example. And then the counteraction mostly comes from our own body's reactions to it. So the initial action is mostly the remedy and a little bit of an adorable dog, which is my dog. Or in this case, I'm just symbolizing, you know, the patient who's getting the treatment. And the after action is really from the adorable dog, the patient. He's sitting next to me as we do this. So important points from this aphorism is every medicine affects the body and causes a primary action. So even, you give a medicine to your provers, you're going to get a primary action. But actually, every stress on the body causes a primary action. So, Jeff, can we open up the microphones? And I just want to hear from people, what are different stresses that our patients might experience? Okay, who wants to shout out something? Do our patients experience stressors? Everybody there?
Well, Shelley, just about anything could be called distress. So whether it's family dynamics, whether it's the good or bad stress of jumping in the car and going to visit the veterinarian, whether it's strong foods, there's all sorts. There's all sorts of them, and that's part of our challenge as clinicians is differentiating the naturally occurring disease from those primary actions that are from more external.
Right, exactly. And, we always talk about the influences on the patients that are the obstacles to cure as well. So anything, it could be cold stressors, it could be over-exercising, it could be a dog who hates being shown, who's being shown, or a horse who hates performance stuff and has to do that. So it could really be anything. So these initial actions, this is another important point from aphorism 63. These initial actions can be caused by medicines or toxins or physical stressors like getting heat, chilled, physical exertion, exercise, or emotional stressors, as Sue pointed out. And even conventional medicines, we know, cause primary actions, and that's the action we're trying to achieve with them, like analgesia, or an anti-inflammatory effect, or an antitussive effect, or anti-diarrheal effect. I chose a lot of antis. So those are the primary actions of the conventional medicines. So let's talk about more of aphorism 63. To some extent, the primary action is dependent on the life force of the patient, but mostly comes from the medicine, as we've already said. The primary action is what we're observing in the provings. We've said that too. And in the provings, we know that some provers will show us many symptoms, while others will need multiple doses of the remedy before we can see any symptoms. Similarly, when referring to sick patients, a patient with a weaker life force might be affected more by a certain potency of a medicine, while a person with a strong life force may be more resistant. So that's all in the posology to alter that. The secondary or after action or counter action is what we call the curative action in the homeopathy patient. And this is what Newton said, for every action, there's an equal and opposite reaction. So the body is responding to that stressor of the homeopathic medicine. So today we understand the counteraction based on physiology, including at the cellular level. And you may not even ever have to think of that as a homeopath. But after I learned this, I thought it was so fascinating, and it's how I visualize what's going on every time I give a remedy. So, and we talked about this, I think I presented this at a homeopathy meeting, an AVH meeting a few years ago, but when stressors are applied to cells, you have these things called heat shock proteins, and they go into action and they repair the damaged proteins in the cells. So what happens is proteins are supposed to be folded, as demonstrated here by clearly what looks like a folded protein. And then when heat or a harmful substance attacks the cell, the proteins denature. Okay, so normal folded, denatured. And then the denatured proteins are detected by the body, and these heat shock proteins mobilize. They come into action. They're created by the body. And so what happens is these heat shock proteins gobble up the denatured protein, and they spit out a nicely folded, refolded protein. Okay, so the heat shock proteins, that's the first concept, is the heat shock proteins understand that there's a stressor that screwed up the proteins in the cell, and they mobilize, come into action, and make nice, beautiful new proteins. So this was a study, and there were actually many studies that were done on it, but what they actually showed was that homeopathic medicines that can cause damage to elicit certain heat shock proteins to come into action in cells can also cure damage by other toxins that elicit the mobilization of similar heat shock proteins. So that's a big long sentence, not quite as long as some of Hahnemann's, but the point that I'm making here is that heat shock proteins act by the similium principle. Similar heat shock proteins are produced. So let's look at that. Here you have schematically represented heat stress proteins, what would happen in heat stress, okay? And then if you gave arsenite, which is the stand-in for arsenic here, you would get these different types of heat shock proteins produced, like a different group of them. And if you gave lead, you'd get an even different group. So what does this look like? You've got a little more similarity here between the heat stress and the arsenite than you do with the lead and the arsenite and the heat stress. Okay, everybody see that? So we understand that the body works as an integrated unit, and this means that homeopathic medicine's primary and secondary actions might be manifest in different organ systems as well as the emotional level. And actually, I do want to go back a second because I realized I didn't have one more slide in here, but what this basically means is if you apply heat stress to a cell and then you treat the cell with arsenite, you are going to get a much better curative response in that cell than if you treated that heat stressed cell with lead. And they've shown this. They looked at survival of the cells, and I don't have those slides on this PowerPoint, but they looked at all of this and they found that if heat stress generated these particular proteins, if arsenite generated these and lead generated those, that you took the heat stressed cells, treated them with arsenite, better chance of survival. So we know this on the cellular level, how homeopathic medicines might be working. But then my point is that it's not just happening on the cells, the body works as an integrated unit. So you're going to see things happening in all different organ systems at the same time, and even at the emotional level at the same time. Everybody should know the answer to this. I did give this lecture in Japan, and homeopathy is a little bit newer there, veterinary homeopathy, than it is here. So there were a lot of concepts that I was trying to drive home. And one of them was, as most of you know, the idea of the concomitant symptom. Okay, and there it is. So like back pain occurring with the flu, GI upset occurring with nasal aspergillosis, which was this dog here who did really well. Aphorism 64, the initial action of the impinging medicine is received passively by the body. Okay. The life force, when possible, elicits the exact opposite counteraction, as we talked about above. This is proportional to the life force's own energy. If there is no state in nature exactly opposite to the initial action, the life force will still mount a counteraction to reinstate homeostasis. Okay, so even if we didn't get the exact remedy that was capable of doing something, or initiating something in that individual, the life force is still going to try to do something to make it better, to achieve homeostasis. And then aphorism 65, Hahnemann gives 8 examples of the initial action upon the body and the life force, along with opposing counteractions. I'm only going to go through some of the examples, the ones that have direct relevance to veterinary medicine. So an arm immersed in the coldest water for a long time is at first far paler and colder than the other one. That's the initial action. But once it's removed from the cold water and dried off, it becomes not only warmer than the other, but hot, red, and inflamed. So that is the after action of the life force. So I remember learning this in vet school, and it seems to still apply. When ice packs are necessary, you don't want to put them on for more than 20 minutes, or you're going to get a compensatory inflammation proportional to the initial cold compress. So, for example, when we castrate male dogs, we'll put ice packs on there, especially on the bigger dogs where you know there's going to be a problem. But we only keep it on for maybe 10, 15 minutes because we don't want to get that effect that we didn't want to have, which big red, swollen, inflamed scrotum with fluid inside. Okay. So let me see if I can get this on full screen here. There we go. So aphorism 65, Hahnemann says, the heavy stuporous sleep caused by opium, which is the initial action, is followed the next night by greater insomnia, which is the counteraction. So again, when we do surgery on animals at work, we use opiates for sedation and pain control. And a lot of people report that the animals were up all night long afterwards. And I don't think it's just because they were sleeping for an hour. I think it's because they're having that reaction as the opioid is wearing off. Aphorism 65, after purging produced by bowel stimulating medicines, which is the initial action, constipation of several days duration results, which is the after action. And I remember years ago having a case, I think it was a cat, it was either a cat or a puppy. And that I think it was a puppy, was going back and forth between constipation and diarrhea. And so I think we had some diarrhea and then it was constipated. And then I think we gave it an enema. And then the owner called and said it has diarrhea. And I said, let's not do anything anymore. And so we just let the body reach its own homeostasis there. Okay. Aphorism 66, again, this whole category where Hahnemann, this whole section of the organon where Hahnemann's talking about actions and counteractions. In the healthy body, with the impinging action of quite small homeopathic doses of attunement altering potencies, which are our remedies, a conspicuous opposed after action will not be perceived. This is understandable. To be sure, all of these potencies in small doses bring forth an initial action that is perceptible with due attention. But the living organism produces in return only as much counteraction or after action as is required for the restoration of the normal state. Okay, so now in this context, let's talk about palliation, suppression, and cure, and the primary and secondary actions of medicines. So we all know different types of conventional therapies. Antipathic is the opposite. So like applying ice to burns. And Dr. Pitcairn tells his famous story of trying to burn his arm after he burned his arm, or his hand after he burned his hand. Okay, so, and that would be to get the homeopathic response, or in that case, isopathic. But here, ice is applied. This is what most people tell you to do, right? Allopathic would be another response. So what makes a therapy allopathic? Something like taking antibiotic for sinusitis, because an antibiotic in a healthy individual, when given, doesn't produce sinusitis. Okay, it's a totally different disease that you're giving an animal. So, for example, I had a message tonight, and I didn't get to speak to the owner, but it's a really strange case. I don't know if anyone has ever heard of acral mutilation syndrome, because I certainly didn't, and I don't feel bad because the dermatologist hadn't either. And apparently, when this dog that I saw the other day, my patient, presented to the dermatologist, this is before it was my patient, the dermatologist said, oh my God, I just saw another dog like this 2 weeks ago. And he was able to start putting the pieces of the puzzle together. It's a rare autosomal something or other genetic disorder. And blood samples had to be sent to France for the diagnosis. And it was diagnosed in another dog. 3 litter mates are already dead. In this, have been euthanized in this litter, and how it manifests is these dogs basically chew off their feet. It's horrible. And this dog that I saw, I think, is 8 months old, and the owner is beside herself. It's a sheepdog poodle mix, and what's also strange is the French never saw it in either of those 2 breeds. And it's an adorable, happy dog. Life is wonderful. And supposedly it has it's a painless thing. And these animals, people that have this report maybe a tingling, but they don't have pain. This dog, even though it has ulcers on its pads and it's chewed off toes and it had like one toe amputated already, it doesn't feel pain. It never limps. So guess what remedy I gave this dog? Anybody want to guess? Jeff, you want to turn on off the microphone or on the microphone?
Right now, there are no hands, but I bet Sue knows.
Sue?
Or Judy or Henrietta.
Or Jeff.
Or me.
And
Did you?
it could be wrong.
Yeah. Did you give him opium?
I would be looking in the rubric, painlessness in things that are usually painful.
Yeah. Yeah, exactly.
And it's not a very big rubric, as I recall.
Yeah. And there wasn't much else to the case. It was interesting. I'm trying to remember if there was maybe a third symptom.
My first thought would be opium. But there are a couple. I just actually looked it up. Helleborus and stramonium are in that rubric as well. But
right, yes, because I did look up the whole rubric, and opium was the only one that fit this dog, which was interesting. I mean, it was sort of like obnoxiously happy as a puppy.
Yeah, like that opium high, like
primary effect,
yeah.
The primary action, right? So we're hoping to elicit the counteraction then in this dog. So we'll see. But my point here is I go on the invoice and I write a lot of notes for the owners. And this owner was a little challenging. She asked very good questions, but you could see she was still really stuck in the conventional paradigm. And she told me that today she was going to the dermatologist for a follow-up. So the message that I got was, and I told her in my notes, no medications, topical or oral, because the dog wasn't on any at that point. Or maybe it was maybe on mupirocin topical. I guess that's an antibiotic. Anyway, so I told her you can stop it. So she went to the dermatologist, and the message I got was he said the dog has a bacterial infection and prescribed medicine. And the message didn't say if it was oral or topical. I'm assuming oral. Should she give it? So that was a conundrum because homeopathically speaking, no, she didn't need to, but she's just seen a board certified specialist, and I have no idea what is going to happen with this really strange disease that I've never even heard of until 2 days ago. So I left it up to her because some people really need to do this, but I talked to her about, I didn't exactly talk to her about she's giving another disease, but the way I described it was when you give an antibiotic, the body perceives it as a foreign invader, a toxin, a stressor, and it mobilizes forces to detoxify against that antibiotic. So you're diverting the body's resources to that antibiotic and taking it away from trying to heal the feet, the whole body from this disease that it has. In essence, driving the car with the brakes on. But I said to her, if you feel more comfortable giving the antibiotic, then we'll repeat the I'm trying not to emphasize that I gave opium and I wrote poppy on the label, but that I said to her, we'll give the remedy more frequently. And I did it as blanking on his name from last speaker last month. Gregory Pace. Yes. And I really enjoyed his lecture. He talked about taking the centesimal potencies and diluting them in water in the same way that we do for the LM potencies. And it is something that I have been doing for years, but it just, the way he said it made me feel a lot more confident doing it, and that you can repeat these a lot more frequently if need be. So I thought in a case like this, where she's going to give an allopathic medicine, and it could screw up the case, or it could put the brakes on the case a little, then I know that I might have to repeat the opium a lot more frequently. Any questions on that? And I have no idea if that's going to be the right remedy for this dog. I'll let you know, but it just right now was the most obvious one. Okay, so palliation. Let's see if I can move this. Every time I tap that, it does that. All right. Okay, so here we are. In palliation, a medicine has to be given repeatedly to achieve control of the patient's signs. For example, in otitis externa, topical ear meds have to be repeated frequently to control the signs. This is because their actions either allopathic or anapathic to the patient with the ear problem. In other words, it's impossible to annihilate the disease symptoms with opposite medicinal symptoms. When a body's given a palliative medicine, at first it feels good. Okay, so that's like opium or any opioid in material quantities. But because the palliative isn't working homeopathically, it's not presenting a similar, stronger artificial disease. It can't act on the patient the same way that a similar disease, a homeopathic medicine, would. So the palliative medicine can't eradicate the disease. Palliatives have to be given repeatedly and in large doses to achieve their effects. This is what we do in conventional medicine, essentially. We control symptoms, and we do it by giving palliatives repeatedly, sometimes lifelong. Meanwhile, the body is producing the equal and opposite reaction to the medicine. This always happens, although conventionally it's only discussed for some medications. Okay, so what does the body do? The disease symptoms become worse. And even if you are prescribing conventionally, which I find myself having to do a lot, I use this information to explain to people what might happen. So, I'll tell them, all right, your dog has otitis externa. It's probably going to be a lifelong proposition. I'll give you a year of refills. You don't have to call me each time the ear gets bad again. So I think that's something very important. And then likewise, you can have suppression. So let's just talk real quickly about rebounds. What are some examples of rebound reactions you see with medications or other therapies? Anybody's feeling brave tonight? Would you like to just talk about some rebound reactions you see? Do you have the microphone unmuted, Jeff?
I have a list. Nobody is. Nope. No.
So nobody wants to say anything?
You can call up somebody.
Do I have a list? Let me see if I click on this. Doesn't
Call on somebody other than me.
How do I see who the people are?
Actually, you may not be able to see who they are. Jeff might be the only person.
Yeah, I can't see because I just tried to expand that.
You just have to open your control panel.
Okay, how do I do that?
The orange arrow on the top.
Okay. And nope, that was open.
Okay, then you have to click your attendees arrow so it points down.
I did, yeah, nothing happened when I did that.
Really?
There'll be a thing that says attendees on the top and staff on the top.
Oh, there we go. Okay, so it's all of us. No, looks like is that right? Henrietta, Jeff, Judy.
Right, but
because it's
that's
10. Oh, that's Jeff. Got it. Yep. All right. All right.
Looks like Joletta has her hand up, so I'll unmute Joletta. So, Joletta?
Can you hear me?
Yeah. Hi, Joletta. How are you?
Unfortunately, I got bronchitis. I'm not doing that great right now, but anyway, yeah. Things like the patient becoming hyper or anxious. Sometimes you see that kind of reaction as a rebound. Like say some medication that supposed to be more relaxing, but they become hyper instead as the rebound? Is that what you're
Like
looking for?
trazodone, I think that's the side effect of that. Yeah. Or that's
Okay, I mean,
actually the idiosyncratic reaction, but it's an action of trazodone.
all
So
right. I mean,
yeah,
you're just talking about other medications and therapies, not homeopathy.
correct.
What you,
Yeah. So like
oh,
what homeopathic ones would, not non-homeopathic, what conventional medicines
All
when
of them.
we withdraw them, rebounds. Yeah. Yeah. And what are some
All of them.
obvious ones that we talk about?
Robaxin spasms, Visine gets the red eye, rebound hyperemia, rebound migraine headaches, rebound congestion. I mean, you see it on all sorts of, if you start to look for it, you'll see it. Typically, you don't see it if we re-interfere by reapplying the conventional medicine, either in a bigger dose
Yes.
or adding something on.
Yeah, yeah. I remember I had bad horse allergies when I was in vet school, probably related to the emotional state of I really hated large animal medicine. But anyway, translating into the nasal level, I had asthma and everything from it. So I was on literally 5 medications. This is my pre-homeopathy days, 5 medications to get through large animal medicine. And as soon as I finished my large animal rotations, I stopped them all cold turkey. And I went into my small animal rotations totally congested and constricted from the rebounds. But anyway, and then I had homeopathic treatment later and got better. So, okay, good. So those are some examples. And
So
okay,
did your homeopathic treatment get you liking large animal practice or not?
well, I actually had a horse at some point, and I found that, I'd go into the stable and I'd put the mask on and I'd groom the horse before I'd get on every time. And eventually I realized I didn't even need to do any of that stuff. But I think on a skin test, I probably would still be a little positive. But I've done very well with horses, and I grew to really enjoy riding and loving them. But okay, so I'm going to get rid of this and go back to here again. Sorry, this is the way my computer's going. Okay, a pain medication is given and then stopped. The pain will become worse. These are some examples. Steroid relieves otitis externa temporarily, but the next round of otitis externa is worse. And beta blockers lower the blood pressure and heart rate, but if withdrawn too quickly, you'll get hypertension and increased heart rate. And, another one that I deal with a lot is Prozac, that a lot of dogs are on Prozac and the people want to stop it. So you have to slowly take them off that unless you want some liability for dogs biting. Okay, so this concept is important when we're treating cases that present on conventional medicines. And I talked about this earlier. A rebound is likely when any medication is withdrawn too quickly. So the medications have to be managed judiciously so that they're withdrawn at an appropriate speed as the patient's healing via homeopathy. If the meds stop too quickly, it becomes difficult to separate out a homeopathic aggravation, the secondary reaction, versus the rebound of the medication withdrawal. And again, this is really, really challenging, but a lot of times now I will just tell my clients, especially seizure cases, the last thing I want to do is stop the medication before I know the homeopathy's kicked in. And I have to say those are very successful cases in my hands, the seizure cases. But diarrhea cases too, itching cases, any of those, you have to be really careful about creating a rebound in those animals by withdrawing the medicine too quickly. You'll have a really ticked off owner, number one, when the animal makes a billion hot spots. But number two, it's real hard to interpret. So I like to modify one variable at a time. And typically the variable is the introduction of the homeopathic medicine, followed slowly when it seems like from our homeopathic evaluations, the animal's improving. So maybe more energy, all the other symptoms that you're looking at, as well as the itching is stopping, or that it hasn't had seizures, or it had a very mild seizure or whatever, then you can start to withdraw the medicines. And typically, like in diarrhea cases that come in on 2 or 3 medicines, I'll withdraw the one that I think is doing the least, whatever that might be. And then I'll go ahead and start doing the next. And it might be one per month. It, depends on the pace of the case and the cure too. So knowing what you now know, why do cats seem to get better on antibiotics for sterile cystitis? Who wants to answer that one?
You've replaced their disease with a medicinal disease.
Yeah, exactly. It's what I said before. You gave them the antibiotic disease. And we know that most cases of cystitis in cats are going to be self-limiting anyway, but here you give an antibiotic, and let me just backtrack a second. Whenever I'm doing a cystitis case in cats, I tell people that except if the cat's on a super crappy diet, 99% of the time, it's an emotional problem being expressed downstream, pun intended. So, why do cats seem to get better on antibiotics? Well, they have some emotional problem, like the cat that's been living in the upstairs bedroom has just been introduced to this cat downstairs in this cat's living room. It's turf. Or, my God, my owner has a new boyfriend. Or there's a Christmas tree that just appeared in my living room. Or a dog visited 3 months ago and I still am not over it. So, you can have an emotional problem from cats. And what you need to do really is match your remedy to that cat's weakness, that cat's susceptibility. But instead, you give an antibiotic. So this poor cat is struggling from an emotional disorder, and you just gave it a toxin that is aimed at killing bacteria. So the body mobilizes to kill that clavamox toxin. And then when that toxin is withdrawn and the body's finished detoxifying from it, the cat cystitis comes back. Hence, we say cystitis in cats is typically a recurrent problem. Okay, so we just talked about that. All right, so Hahnemann did say palliatives or antagonistic treatments are only justified in highly urgent cases, such as sudden accidents to previously healthy people where danger to life and imminent death permit no time for a homeopathic helping means to act, not hours, quarter hours, or even minutes. Okay, so let's now look at the provings and the symptoms in the repertories. And this is something that was brought to my attention by Jeff, what's his name, who gave the TBR2 course?
Jamie or Demetriadis?
Yes, yeah, Jamie.
Hoskins.
What was it? Jamie, yeah.
Yep.
Yeah, I can't think of his name, but it was an excellent course, and it introduced me to the Boninghausen Repertory 2. That was a 10-year endeavor of George Demetriadis. Excellent repertory, and I do use it a lot now in practice. It's really helped me. So this was something he talked about, and I've kind of modified it a little to be relevant to us. So true or false? Both primary and secondary symptoms appear in many repertories. So I can't really call on anyone. It's not like Vin where I can do a poll. So, and I can't see who's raising their hands, but do you think that both primary and secondary symptoms appear in our repertories? Okay, the answer is true, they do. Well, so what does that mean? That means you're looking under a rubric and you are looking for, I don't know, let's just say that, a good one here. The panosteitis is better from cold. So, that's the symptom you have in the animal. So you might look up leg pain better from cold, and you see it in there. You look up leg pain better from hot, and the remedy's there too. So what does that mean? How do you know? What is it with this remedy? Okay, let's keep going. So Kent versus Hahnemann. Kent felt that both the primary and secondary symptoms were all symptoms of the remedy and therefore could both be used in prescribing. Hahnemann counseled us to prescribe only on the primary symptoms. So, how can you tell if the symptom listed in a rubric comes from a primary or secondary symptom? Do you look at the grade? So you're on Kent's repertory or you're on the complete 4.5 repertory. Will looking at the grade tell you if it's a primary or secondary symptom? What happens if you look directly at the provings? Will you be able to tell from the provings if it's a primary or secondary symptom? And what happens if you know in advance if your repertory uses secondary symptoms? If you know that the repertory doesn't, then you know that these are all primary symptoms.
And there's only one of those, I think.
Yes. So you have A, look at the grade, B, look directly at the provings, and C, know in advance if your repertory uses secondary symptoms. So what's the answer?
Stephen says provings, B, provings. Look directly at the provings.
Right? That is one of the two answers.
Mm-hmm.
And that's an excellent one. And I have to say that the past few years especially, I've gotten more and more into using the provings. And then after taking the TBR2 course, I always look directly at the provings. I use Hahnemann, Materia Medica Pura, chronic diseases, and I use Allen's. What's Allen's? The big one for Allen's. And then I use what?
Allen's Encyclopedia.
And I use Herring's Guiding Symptoms, because I think those are my three most reliable sources. And then I may look at a bunch of other repertories just to get some other ideas, but those are, I find, the three most reliable. So, and it gives you a lot more information. I'll get to that in a minute. But the other answer here is C. You need to know in advance if your repertory uses secondary symptoms. And TBR2 does not. It just uses primary. So grades don't tell you if the symptom is primary or secondary. What do they tell you? And I've heard a million different things about this, so this really clarified it for me. But in the Boninghausen Repertory 2, which for short is TBR2, grades tell you the reliability of the symptoms. They don't tell you the intensity. They tell you the reliability. So in TBR2, if a remedy is in parentheses, it means it's dubious. You know, they're not sure. Grade 1, the symptom is certain but not prominent. Grade 2, the symptom was prominent and repeatedly appeared as a primary effect but has not been confirmed clinically. Grade 3, prominent, repeatedly confirmed as a primary effect and has confirmed cure undoubtedly from the remedy. And grade 4 repeatedly cures homeopathically. So again, in TBR2, the grades are proportional to the reliability of that remedy for that symptom. Other repertories, most are compiled from multiple dissimilar non-primary, not the original repertories, so sort of the whisper down the lane effect. These sources each have their own grading systems, and they're often not consistent from one repertory to the other. So when they're combined into the new repertory, they might have yet another grading system. So the conclusion is the grades in most repertories are unreliable. And basically, if I am using another repertory, I just look to see if that rubric appears in the remedy. I don't look at the grade of it. And then I'll go back and I'll start reading you know, the primary sources to see if that is the remedy that I need. So again, TBR2 has the primary symptoms. It's formatted differently. It requires some study to be able to use it. If you are interested in it, I would just free plug, talk to Kim Elia. He'll sell you the webinar on, maybe you can get a discount. But it was excellent because I learned a lot more than just how to use that repertory. It only has 125 remedies in it though. But as Jamie, who taught the course, said, I think he said something like at least 90% of the time he doesn't have to look further. And in my case, if I'm not happy with the remedies that are appearing, I will go and use the complete repertory. And sometimes I'll compare what I find in both of them. So read the provings. Most materia medica that you look at leave out the symptoms. Some will just give you the essence of the remedy. They'll focus a lot on the behavior, or they might just summarize the major symptoms. But what you're looking for might be a really small symptom that isn't going to show up in these materia medica. So reading the provings gives you the most information. You can see how the symptoms first appeared in the provers. And this gives great insight into how that symptom was translated into a rubric. And, you know, I know that sometimes I'll look at a rubric and you'll see a lot of different remedies in there. And Sue, I remember we had you give a talk on this years ago at an AVH meeting. It was great. Anyway, what you then do is you go back and you're looking at how that symptom appeared the very first time in the provers, and you can see how it made its way into that rubric. And it might be something totally different than what you were aiming for, in which case you might decide, oh, well, it looked good, but clearly this isn't the remedy that I want. So you can see which symptoms occurred in multiple provers, possibly at different times of day or at the same time of day, for example. And that it shows you that what you're looking for is really reliable if you see it in multiple provers. And you can see how the modalities influence the proving symptoms as well. You can see if the symptom of interest is a primary or secondary symptom, and how is that? So sometimes you'll see when you're reading the provings, it'll say, the symptom will be followed by secondary effect. Like it will literally say that, or a curative effect. So that's an easy one. You know that, all right, that's not a primary symptom. That's what happened when the person rebounded from the remedy. There's another thing that's a timestamp that you'll see, and that can also be helpful. For example, for retacarb in Hahnemann's chronic diseases, you'll see lack of memory after 16 hours. So it gives you an idea of when that when that symptom occurred. So that gives you a reference frame. So bear with me here. Don't assume that a symptom with an early timestamp is primary and one with a longer timestamp is secondary. So you might see in a remedy timestamp 1 hour and then another timestamp 24 hours. Or you might see in a different remedy a timestamp of 5 hours and a timestamp of 10 days. So you can't make any assumptions until you start looking and comparing all of those timestamps relative to each other. So if the provings seem to show marked primary symptoms as evidenced by their occurrence early in the proving time frame, and then the provings show opposite symptoms that occur later, which could be hours later or it could be days later, then we can deduce that these later symptoms are secondary or counteraction symptoms. So let's look at some remedies. And remember, I said this is relevant to veterinary medicine since a lot of vets drink coffee. So is coffee a stimulant or a sedative? We all know the answer to that. So from the provings, the greatest mental and physical exhaustion after 45 hours. What? Inattention and loss of thought after 48 hours. Are these descriptions of the initial or the counteractions? So everybody should know that. These are the counteractions. 45 hours, okay? That's not even 2 days worth, okay? But we know that from coffee. Coffee, you'll also see in the provings unusual activity of mind and body until midnight, or in my case, until 3 a.m. if I happen to drink coffee. And that's after 6 hours. The greatest activity of mind, acuteness of thought, vivid flow of ideas. So these are obviously the initial actions of coffee. So you see, you have to compare. You have to go back and say 45 hours for this remedy. Well, gee, that sure seems like the opposite of these 6-hour symptoms that you're seeing. So in Kent's repertory, we see coffee listed as a grade 3 under mind ideas abundant. and grade 1 under mind, memory, weakness of. Okay, so Kent's listing both of them. He gives it a grade 1 under weak memory. But in TBR2, we see coffea listed as a grade 4 in the rubric mind, intellect, activity, excessive, and absent from the rubric mind, intellect, activity, excessive, weakness of. Okay, so why is it absent from the last rubric? Because it's a secondary symptom, a counteraction symptom. So it's not included in TBR2. Let's look at a different kind of remedy, sort of the opposite. Phosphoric acid, or phosphoricum acidum, has an opposite state to that of coffea. Weakness begins on the emotional level, indifference occurs, and the mind becomes weak as well. And it's a major grief remedy. And a lot of people report their animals just go in a corner and stare at the wall. If we look at the primary symptom in Kent, we find phosphoric acid as a grade 3 in mind, prostration of mind. Okay, that's good. But also grade 1 in mind, ideas abundant. So would anybody here ever prescribe this remedy for a dog who had abundant ideas? Well, might not know that. Anyway, in TBR2, we find phosphoric acid as a grade 4 under mind, intellect, activity, excessive, weakness of, and totally absent from the rubric mind, intellect, activity, excessive. Again, why? Because we're not looking at the counteraction, the secondary symptom. We're only looking at the primary symptoms here. Okay, so that's all I got. Anybody have any questions?
I don't see any questions, but I just want to make one quick comment. When you were talking about your vitality model, which basically is a stress and strain model, that Hahnemann talks about, that you described, I think Milgram's work, if you look in Homeopathy, has a couple of great articles about, one of them is about a gyroscope, where the faster and the higher the vitality, the faster the gyroscope spins, and the greater the stress of the dissimilar drug has to be in order to get it to topple over or make you sick. So that would equate to being susceptible. So I guess so. It's a great. He's got some great work. I'm just gonna put that in the chat.
Yeah, maybe you can post that on the forum for us too.
Yeah, sure. But I don't see any questions. Henrietta, Judy, Sue, none of us can raise our hands, so, but you're unmuted, so just say, Henry asked, and I'm gonna ask what he wrote first. He asked about the iconoclastic Ignatia in this context. I guess
meaning that Ignatia can be both.
the alternating of symptoms, right?
Yeah, it's interesting you said that, because I was wondering if that question would come up tonight. And I actually looked up Ignatia last night, and I went to Hahnemann's, which one did I do? I think it was Materia Medica Pura. And what I found was that he stressed a lot that you have to keep repeating it, but that it was an initial action. And he really emphasized the difference between the initial and the counteraction, I guess is the best way to say it. Let me see if I can find it here. Well, he talks about, Henry, are you talking about the rapid alternations of gaiety and disposition to weep? Is that the one you're mentioning?
Let's see if we can get Henry. Can we hear you? Can you hear us? Nope, he's typing. Let's see if he typed. Yes. Okay. Well, you're unmuted. If you have a mic, you can say what Shelley asked. Nope. Or just type it. Yeah. All right.
He says here, it's peculiar opposite primary actions, alternating actions, follow one another in this opposite way when it is given in diseases, so that if the first dose has removed the morbid state, a second must be given soon afterwards, for this would cause a recurrence of the morbid state because its opposite alternating action comes into play, which produces the injurious effects of the secondary action of a palliative. Good luck with that one. So what did Henry say?
Nothing that I can see. Wait,
Okay.
wait. Oh, yeah.
Well, I actually have a recent Ignatia case. It's only about a week and a half old, but it was a really amazing response. It was a dog with panosteitis in the distal humerus. And I'd seen the dog because it jumped out of the truck and was lame on that leg. And this is a 3-year-old German Shepherd, so breed at risk, but 3 years old. And had a history when it was a puppy of some alternating hind leg lameness that the vet never x-rayed, but said it was ligamentous. But the owner, it was the son at the time, was pretty convinced that this was panosteitis, and it was untreated. And so it moved from the hind legs to the front legs, apparently, in this case. And it was pretty outstanding x-rays on this dog. So I took the case, and what was interesting, I mean, I said, does your dog ever sigh? And this dog sighs and whines all the time, and it alternates between just being a really happy dog and being a dog who is depressed because its owner is in the military and will come home, and then the dog's really happy, then the owner goes away. So it's bonded to the owner's father and mother, and then they go to work and do things like that. So the dog spends a lot of time being heartbroken. And it was in my face from the very beginning, but I didn't make that connection till Ignatia kept coming up. And Ignatia has a lot of humorous symptoms, which is interesting. And I told the woman to give it once, prepare it in water and give it once. And so like so many people, she gave it every day. And so I guess that took care of all these alternating symptoms. And I do a 1-week follow-up just to see if we have to adjust dosing the dog. And she said the dog's it was immediately 95% better and is 95% better, a week later with the limping. So we're going to, and I don't have the case in front of me to go over all the symptoms, but it was doing really well. So that was interesting. And I wonder now if I just kept capturing the alternating state by repeating the remedy so much. So anyway, and I, by the way, I did tell her in that case that I'm reasonably sure that dog's going to need another remedy. But for now, we're sticking with the Ignatia. So any other questions? We have 2 minutes. Okay.
Yeah. I don't know. I see anything. Sorry. So,
okay, you guys can always post on the forum too. We can continue the discussion.
So this was great. Just too much to even think about. So thank you, Shelley. We look forward to your behavior presentation for the.
Actually, I can't take credit for that one all the way, so I'm not going to do that one.
All right. So thank you all for coming, and we will see you next month. I believe March 14th as well. So
some of you at the ranch and the rest of you at the end of October at our big annual meeting.
All right. Thanks.
Okay. Good night.
Good night.
Thanks, Shelley.
You're welcome, Sue.